Now, up next, we are going to one of my wonderful friends, Fiona Gower, National President for Rural Women, and talk about, firstly, Fiona, I know you've been dying to get down to the batch at Port Waikato. I'm sure you must have made it down there this weekend.
Well, yeah, we're living at the Port Waikato, so I've got the beach here on the farm, but we have a beach house down in Maricopa,
Oh, yes,
and we
sorry.
hadn't been there since, I hadn't been there since January, so we were hanging out to get down there and checking everything out with things like lawns and the house to make sure everything's okay, and it was just fantastic, beautiful weekend to be down there and just relaxing, having a few wines with friends. Great. It was brilliant to be out again.
I've got to stop promising you a bottle of this rosé from Bob and get this up to you, but I'll come with it. That's always the
Absolutely.
thing as well.
Sit on our beach and enjoy.
Oh, and would you support my opening comments that we've got to remind ourselves we live in paradise and we've got to be some of the most fortunate population in this world right now?
We do, and I look at where we've been during the whole level 4, level 3, and going to level 2. We do live in paradise. I mean, where we are, we've got the best of everything. You know, we've been able to extend out, and I guess it's rural communities do that because we do have the land that we can spread out and do things on. So, really loved it, and beach, bush, rivers. We're so lucky.
Okay, so getting into the nuts and bolts of it, obviously the budget, there's a lot of uncertainty, so there's devil in the details, no point sort of talking about things we don't really know yet. But what was your hopes pinned on, and what stood up for you and didn't?
Okay, so we're really looking at some of the big issues that we deal with, and of course one of them is around health issues, and really great to see that the DHBs are getting funding, and there's 177 million going into the maternity services, and we're really hoping, after all the issues we've had in the rural sector, that our rural midwives get a slice of that so that they can keep on working, and that primary care that we have there, that our women are having equitable services and safe babies being born in wherever they are, and making sure that we can attract people to these services and out into rural, whether it be rural professionals. We'd like to see, more people, the doctors, the nurses, the dentists being attracted into our rural communities, because really important to have them. So that's some of the things we'd like to see. And with some of the other money being spent is about how can we use things like telehealth a lot better to prevent all our rural people having to travel long distances to get services. And I think that's big issue for a lot of us, because it's a long time travelling, whether it be in miles or in time, to get to services. So things like we've already got the mobile surgical buses. We'd like to see a few more these mobile buses, health buses, getting out and about to do some of those services for our rural communities, especially for those people that don't drive or have issues getting into town. So we'd really love to see some of that come through if we possibly can. But certainly the maternity one is the one that we'd like to see really well supported.
Oh, it's been just a slide for a long period of time, and to that point it's got just far beyond. Absolutely, I totally agree, and good on you for all the advocacy work that you do in that space. There's a great article today on Farmers Weekly, training our rural doctors, with Dr. Anna Fisher from Hara Hospital, and the rural hospital medicine training program is relatively new, and this is what include to be able to encourage more GPs into rural areas, but give them skills, because how is operating different in rural New Zealand for these medical professionals?
Because they've actually got to stand a whole lot of other rural health issues that they've probably never come across before, like leptospirosis is a big one out in rural, E. coli, things like that you don't see in the urban centres that they do get out in rural. And how do they diagnose this, making sure that the tests are being done, understand the distance that people have to travel to get to services is another big one for a lot of people, like where we go, like in the South Island or East Capes or something like that, for people to get to these services, they're travelling a long way, and we have to make sure that they get well looked after. So yes, very different services needed in a rural sector, and a lot of understanding of how the people live and what they do. But yeah, it'd be great to get more people trained and out there and understanding, because it is a fantastic lifestyle along with great career.
Yeah, I know a lot of the policemen in Wanaka love living there because they're all multi-sporters as well, so they get the best of both worlds.
Well,
Now,
that's it. If they're hunters or the fishermen, or they enjoy their tramping, that living in those areas and getting this. And for children, you grow up in a rural lifestyle, you can have the opportunity to do all that great stuff that you probably don't get to do in an urban centre. So I really encourage anybody to look at it for sure.
there's a combination of a few things. I know that wool is your passion, pushing it ahead an agenda around wall carpets in schools under Chris Hipkins' renovations of our schools. How do you think we'll get on there, Fiona? And as well as, do you see that we're going to see some of those funds fall through to our rural schools that infrastructure needs upgrading desperately?
Oh, I would hope so, because we were looking at this question last week when we were looking at the budget and this funding that was coming out to schools, to rural schools, and making sure that they do get them, because often in a community we're very limited to where we get our funds from. The fundraising people for everything is the same, and we need to make sure that these schools are being looked after. The big issue is getting contractors out there is the travel, and so by the time you get people out to your rural schools, half of the budget's gone just on travel. So we'd really, really like to see this money spent on really important things. As I say, wool carpets and wool insulation, keeping our schools healthy and clean are really important, and making sure that our children are being well cared for, and having great classrooms. And we've got the internet there now, so why don't we get everything else up to speed as well and get them really, really learning, so that they're on a par with their urban counterparts with everything they've got, because some of those schools are pretty low decile and they need all the support we can get for them, and it'd be great to see them all up and running properly and with all the services.
I want to talk about this because myself and yourself have been following this rural connectivity game for a long time now.
Yes.
Federated farmers have been advocating for better rural connectivity, yet we have shifted considerably in the last 5 years, and there's another 15 million tagged pre-budget on this.
Yes.
How much more? And are we is it just now about thinking outside the square to get into these little pockets?
It certainly is, and that's where we're really pushing for the government to use the wireless internet service providers, because these ones they're small, they're agile, they can get into those backcountry areas that the large telcos can't get to. So really great to see them on board and lifting it. And we've seen over lockdown under rural broadband, or under the connectivity, the issues that people have had trying to get online and do work. So really, really important that they keep pushing forward for this. And it's not just for broadband, for internet. We would really, really like to see more of the money go into getting cell phone coverage, and that's for a whole lot of reasons, including health and safety, that we need to have that out there, because there's a lot of areas in New Zealand where we live, for example, or where our beaches, there is just no cell phone coverage. So how far do you have to go if you need to get help? Is a big one for us, and making sure that we've got connectivity, whether it be cell phone or with internet, to make it attractive for these people we're trying to get into our rural communities with all the money that's MPI are going to get for all these new projects. If we need to be able to offer them those services, otherwise people aren't going to want to come. So that's a really big push for us. It's for our education for our children, it's for these health services we can do by telehealth, it is for our businesses, it's for our social, we've seen that with their social isolation, the importance of internet, and it's also that health and safety. It's all those things really, really important that we get as much of New Zealand covered as we can. And we often work with the Telecommunication Users Association of New Zealand as well, so TOANZ, and they're really helping us push for that as well, because that's really where they are, and they can see the importance of it as well, getting out into rural, because we're running huge businesses on our farms, and we've got these incredible small businesses that our women do that are on farm, that are relying on internet for selling their products, and we need to make sure that they can keep their businesses rolling as well, because we really need to support them.
Mm-hmm. I was just thinking though, some of those fantastic female-led rural businesses or accommodation places that pride themselves on no internet coverage for those urban people to escape to. So we're going to come up with something you could just blanket around those beautiful on-farm accommodations.
Absolutely. That's where you just take it like we do at home with the children. Oh, look, the Wi-Fi's being pulled out.
Yes.
But I think there is that need, that people really do expect it when they move out in there to live.
Yes.
they need to have that. But when you're just going on a holiday, it's actually, and after having a whole weekend of absolutely no coverage whatsoever, it's bliss. But we do need it for day-to-day living for those businesses as well, because they need to be able to connect with the outside world to promote themselves, and because these are the ones that are employing local people using local produce, and we need to make sure that we can keep them going as well through this tough time.
Thank you so much, National President for Rural Women, Fiona Gower there.
This is Sarah's Country.